Hello, everyone, and welcome back to the podcast. Today, I'm very happy to have Dr. Rai with us. She is a registered dentist based in Toronto and received her Doctor of Dental Surgery degree in 2006 from the University of Western Ontario. Welcome to the show, Dr. Rai.
Thank you so much.
I guess just to start us off, could you describe what led to your decision of becoming a dentist?
Okay, so prior to going into dental school, I was actually a dental hygienist. I practiced hygiene for about 6 months and knew that I wanted to do something more challenging, more involved. And so hence I started pursuing all the prerequisite courses that I needed in order to get into dental school.
Yeah, so I guess as us all being patients, we kind of know the relationship that a dentist has with their patient. But as a dentist, could you describe what being a dentist means to you and the type of work that you do?
You know what, being a dentist to me, it's oh my God, it has so many roles. You're a business owner, right? You're a doctor, you're a dentist, sometimes you're a therapist to your patients, you're problem solving constantly. You're juggling your regular appointments, you're juggling emergencies that call in. You're constantly challenged. I love it. I love it. There's never a dull moment. Every day is challenging, every day is exciting. But above all, I think it's a connection that I make with the patients. Like some patients, I've known them since they were little. You see them grow up, you see them, becoming a part of society, and you just, I don't know. It's I guess as a female as well, some of the patients I've known since they were really young, it's sort of like they're not your children, but you've seen them, go through every stage in life, and you build a good relationship with them, and it's rewarding. It's rewarding seeing them grow up. It's rewarding being a part of their lives, being a part of their family, their extended family, and then and overall helping them with their oral health. So it's the connections that you make, and you're also helping them.
Yeah, and again, as patients, we usually see the dentist once every several weeks or sometimes months, but you go to work every day. So could you
Yeah.
describe kind of what your day-to-day work environment would have looked like prior to the pandemic?
Prior to the pandemic, just like I described earlier, it's unpredictable. Sometimes your day, it looks like a slow day. Then, for example, today looked like a nice, slower day in the sense that I had one patient right after the other, right? It wasn't double booked or anything. It was just a nice day. Then by 9:30, I had all these emergencies that we had to slide in. Someone broke a tooth, someone had an infection. So it's challenging, but prior to COVID, you had the challenges, and then you also had some downtime where you can relax. Like we have a great team, and we all get along really well together. So after hard days of work, we used to kind of sit in the lunchroom, kind of chat with each other, enjoy a coffee, enjoy some food. So that was nice pre-COVID. Now it's not the same anymore at all.
Yeah, certainly. I think that's the first time I've heard someone describe having one thing after another as a slow day. So that's really interesting to hear.
It's slow in the sense that they're predictable appointments, right?
Hmm.
Like, for example, most fillings I usually book an hour for, even though I don't need an hour. So I might be done in a half an hour, 40 minutes, but I can do my paperwork. I can, take some time and respond to specialists and do anything else that needs to be done. So it's a predictable day. It's an easy paced day, right? So I wouldn't call it slow, but it's nicely paced.
Hmm. And you brought this up earlier. Certainly, the pandemic has changed a lot in terms of
Mhm.
your line of work. Can you describe some of your initial thoughts when you first learned about the pandemic that was happening, the outbreak that might occur, and how severely you thought it would impact your line of work?
Honestly, initially when all this happened, I think like most people, you weren't really sure of how it was going to impact you. I mean, it was obviously unprecedented. You didn't realize how long it was going to impact you for. When we were told to shut down, it was like, oh, okay, well, this is a first, right? So, we thought, okay, we'll probably be back in, a month or, 2 months at most. But once, we were shut down and you were, reading more into it, researching it, then you realize the entirety of everything, right? And how it's impacted everyone globally. So that's when you realize that this is something serious, and it's really impacted the dental profession drastically, because we work in the most infectious part of the body, right? The mouth. And especially with COVID, I mean, we're dealing with, you're supposed to cover your mouth. We tell everyone, take off your mask, and we're creating aerosol in your mouth. So so it affected our profession significantly, right? But prior to when we were first told of, learned of the pandemic and that we were to shut down, I don't know. Our thoughts were, we didn't realize the severity of it until, until we were further into the pandemic.
Yeah. So, usually when we think of people who are dealing kind of with COVID-19 directly, we think of hospitals, and certainly doctors and nurses working in those facilities have been impacted immensely by this pandemic in more obvious ways, I'd say. But when it
Yeah.
comes to the dental care industry, I feel as though people are kind of less aware of what's going on in that realm. You mentioned that like earlier on you had to shut down. Could you speak more generally towards how the dental care industry as a whole kind of responded to the immediate outbreak of the pandemic?
Well, you know what? We were told to shut down. It was Sunday. It was Sunday evening. It was, I think it was May. When was the shutdown? It was May 15th. The shutdown happened on May 16th, which was a Monday. Sorry, March 16th. It was March 15th. It was about 5 p.m. We got an email from the RCDSO, which is the Royal College of Dental Surgeons of Ontario, and they were told effective immediately, which was for Monday morning, that we were to cancel our patients and shut down immediately. So we were told the night before. How did it impact us? It was shock, but obviously initially you follow through with everything. We went into work. We canceled whoever we could cancel. The patients that we couldn't cancel, they obviously came into the office and then told them of the situation, had to reschedule them. We were at the time rescheduling them for about 2 months down the road, right? And then as the pandemic progressed and we realized we were going to be shut down longer, then it was just then we just basically had to treat any emergencies. So I was going into the office during the pandemic. I would say I was there maybe 3 days a week for a couple of hours just to respond to any calls, respond to any emails. If anyone had an emergency, if they needed to be seen, they came in, but it was no dental treatment was provided. It was just prescribing some antibiotics, painkillers, and then taking the edge off of things and then bringing them back when it was safe to do so. Right. So as a whole dental profession, how did it affect us? Financially, obviously affected us significantly. Affected our team. It took its impact, but it has with so many other professions, right? So it took its fair share of impact. But I think the initial shock of what was happening, it did take a while for it to register, and the severity of it did take some time.
Yeah, I'm actually wondering if you could speak a little bit more about that, because as a dentist, you are technically a healthcare provider. You're providing your patients with care. And whereas hospitals kind of trying to find ways around the pandemic to still provide that care because it was so urgent. How did you actually try to ensure that your patients were being cared for during that period of time when it was shut down?
During the time we were shut down. So as I told you, we were open. My receptionist was in every day. She was in for 4 hours. She was answering the calls and responding to emails. I was there 2 to 3 days a week and seeing patients if they needed to come in. There are patients that we have a lot of elderly patients that don't have email, they don't have internet, they don't know how to cope in the digital world. So for them, it was just basically they wanted the reassurance that they saw someone, I took a look at it, gave them a prescription and reassured them that, everything was good. They had to hold on, just for a little bit longer. So it was providing, I guess, just support for some of these patients, right? So it wasn't necessarily dentistry that I was providing. It was reassurance and some mental support, and just taking care of their needs.
And eventually your office did open again. Could you talk a little
Yep.
bit more about, the process of reopening and how you transitioned from being shut down in that state, back
Mhm.
to kind of a system where you were starting to invite patients back in the process there?
I would have to say our college was quite detailed as to what we needed to open. They all the information they gave to us was last minute, so we were able to open in at the end of June, sorry, at the end of May. So beginning in June, we were allowed to open, and they sent us an email, I think it was May 31st, underlying what we needed in order to open. So all the systems that they had in place were very detailed, and you did feel safe. So it did take me about a month to get everything in order. So we stayed shut down for an additional month. We were shut down the entire month of June as well, and then opened up in July. They gave us certain scenarios. So if you're going to see a patient that is, asymptomatic, no signs of COVID, then you can treat them, you can follow protocol A. If they have some symptoms, you can follow protocol B. If they have COVID, they're symptomatic, then it's protocol C. So what we did was, I didn't know who was going to be coming in and what they, if they were asymptomatic or if they had symptoms. So I decided to take it upon myself to shut down the office and transform it so that we can treat anyone and feel comfortable. Not just COVID positive patients, but anyone at all. So what we did was we implemented all the protocols that needed to be in place to treat a COVID positive patient. So at the front, we had to install the plexiglass and have social distancing in place. We had a virtual wait room. This is going back right when we opened. So everyone was waiting in the parking lot. And when we were ready to see them, we would, the receptionist would bring them in. We would screen them, take the temperatures, and then all operatories were sealed. Prior to COVID, my whole office was open to above, no doors. Everything was, nice and open. But now with COVID, all our operatories are individually sealed. We've got temporary walls, temporary doors. We also have air filtrations in place in each operatory. So everyone that's working there and everyone that's being seen is safe and is comfortable.
I'm wondering how that feels kind of from your perspective as a dentist, putting all these kind of precautions in place and seeing patients during a pandemic. How does it actually feel to be treating patients in an environment like that?
Initially, it was, initially you felt, I wouldn't say you felt safe, but you didn't know what was to come. Right? Whether the protocols that the college had implemented would keep us safe or would not. That we didn't know, right? So, but as the months progressed and we realized that we're safe, no one's contracted anything, we're comfortable, we're going home, we're seeing our families are safe. That's when you built more trust in the systems that you had in place, and you built a lot more confidence dealing with the situation. So it did take time. I think we were all in the same situation, like the receptionist, to the assistants, to the hygienist, and the dentists themselves. We followed all the guidelines that the college gave us, to the T, and it did keep us. It kept us safe.
Yeah, and I'm also aware that you are a mother of three. You have a family. How does your family actually feel about you kind of going into these environments and performing your duty, but coming in danger with, as you mentioned, working around the mouth, which is the most contagious part of the body.
Mhm.
How does that actually work with the dynamic with your family?
Um, my kids, I mean, honestly, they're. I don't think they put too much thought into it. Right? So as long as they were home, they were able to play their video games, they were comfortable. With my husband, for me, it was more my elderly parents had to say, right? So my parents do live on their own. So my husband and I do take care of them in the sense that, we touch base with them on a weekly, sometimes bi-weekly basis, make sure they have their groceries, whatever they need. So for me, it was making sure that I wasn't giving them anything, right? So that, I was careful enough at work that I would never bring anything home. So even though you cannot guarantee anything, we were, when we saw my parents, we always had masks on. We, practiced a social distancing. We were careful with everything. And then, as I said, after a couple of months, knowing that all the systems that were in place were protecting us, that's when you built confidence. So the family, I would say definitely my parents and my in-laws and my husband, they were all nervous about me going back to work. But at the same time, being a dentist, I mean, COVID is not the first challenge that's ever come our way, right? Dentists went through HIV, they went through, there's Hep B, Hep C. So we're always exposed to something or another, but the systems that we have in place do protect us.
Yeah, I actually think that's really interesting that you brought up kind of different challenges or environments in the world as a whole that kind of dentists had to go through. Going into this particular pandemic, with the experience that you did have, did you feel that it was kind of unique or different in any way? And did you feel like well equipped with your experience to confront the new challenges that this pandemic in particular
I
brought forth?
mean, I don't think anyone was experienced with this, right? So it was something new. When SARS hit Toronto, back in the early 2000s, I was actually away in dental school, right? So it didn't affect me at all. I was in the US, so it didn't affect me at all at the time. Um, so no, this is a new challenge. I think dentists that lived through HIV in the 80s, I don't know if they're still practicing now or not, but I think for them, they went through that challenge and then they went through SARS and then now COVID, right? So for them, it must have been a different challenge, but for me, this was all new. So it's quite interesting. And it's still interesting because it keeps changing. There's always new protocols that we need to keep up with, new things that we need to do. Our college does keep us on our toes.
Earlier, you mentioned that in your office, City Heights Dental, there's a lot of team dynamic that existed, particularly before the pandemic. Could you describe kind of how your coworkers might have been affected by the pandemic, or the different methods that your office is using, and how that team dynamic, as you described, has been affected by the pandemic?
The team dynamic, we're a close-knit group. Some of the girls have been working at the office for over 15 years, and we get along really well inside the office, and we get along so well outside the office. So prior to COVID, we always had a lot of team building events, a lot of um, activities going on. So everyone was always happy, looking forward to something. There was always something exciting to do and something to look forward to. But since we returned to work after COVID, honestly, there's really nothing going on. Everyone comes in, you do your work, and then you just, make sure everything is nice and clean and sanitized, and then off you go. You go home. You come in the next day. We're wearing so much PPE that it's just hard to connect. It's hard to talk to anyone. All you see is eyes. We're wearing gowns. We got our shields on. We're wearing our N95 masks. On top of it, we're wearing surgical masks. You got your gloves. You can't even hear anything properly anymore. Our ears are covered. So it's tough. It's tough, but we're all in it together. We're getting through it, but it hasn't been easy.
I guess looking forward a little bit, how do you think COVID-19 has impacted the dental care industry as a whole? You mentioned that earlier on during the pandemic, when you first opened up, there were some new technologies you were using, like a virtual lobby or a virtual wait room. Are there
Yeah.
any changes that were made during the pandemic that you think were positive changes, and changes that you think you would like to kind of keep?
I liked how everything went digital. To me, it keeps everything nice and clean. We've been digital fully digital for about 8 years now, but there's a lot of offices out there that still had the paper charts and paper everything was done on paper. So for them, it's been a significant change to go digital, right? Everything is clean. You can email patients, COVID forms, everything's emailed and done through text. So it has changed the dental industry in the sense that it's brought it, it's dentistry's caught up now to caught up to where it should be. So those are nice changes. I like the fact that we have the air filters in each operatory. I feel like the air is a lot cleaner. I personally notice it, myself. I usually have allergies in the summer, like being in the operatory, like haven't felt anything at all. Everything, it's nicer, it's cleaner, it's more sanitized. Like the waiting rooms, we're constantly wiping down the chairs and the doors. So it has a lot of positive changes. The negative changes, I would say, are it's hard to breathe with the N95 masks. We're wearing them sometimes for 9 hours of the day, and you go home, you've got marks all over your face from the suction of the mask. So those are hard. If we could do away with those, it would make life a lot more easier at the office.
So, Dr. Rai, I guess just as a final question, and this is something that I always like to end off of,
Yeah.
you're largely speaking to an audience that's composed of students. Maybe they aren't students, but they don't know too much about what it's like to work in the healthcare industry or work as a dentist. Are there any
Mhm.
parting words that you'd like to offer about what it's actually like to work as a dentist during a pandemic of the scale we're experiencing now?
Dentistry, you know what? I love the profession. I love it in the sense that you can set your own hours, within reason. You can set your own hours. You get to pick and choose your cases within reason. You can see whichever age group you desire. You can practice the type of dentistry you desire. You're not forced to, particularly practice, let's just say endodontics, which is root canals or braces. You can practice general dentistry, emergency dentistry. So it has a lot of variety, a lot of variation. You connect with your patients. You get to know them over the years. You get to know their families. You get to know a lot about them. So you do build interpersonal relationship with the patients. It's a great profession. It's always challenging. There's never a dull moment. It keeps you on your toes. So I do love that. I love problem solving. I love constantly being challenged. I could never do a job where it was just, same thing day in and day out. You just clock in and clock out. That's not me. I love the challenge. So dentistry, I love the profession. Working as a dentist during the pandemic has been difficult. It's not easy, and I think dentists have it a lot harder because you are dealing in the most infectious part of the body, especially with COVID. You're dealing with the mouth, you're dealing with blood, you're dealing with saliva, you're dealing with the bacteria, infections, pus. You're dealing with a lot of stuff. So it's not easy. It's hard. It's hard to have. It's hard to wear the gowns, the hat, the N95, the shield. It's not easy. So during the pandemic, I'd rather be doing something else. I would rather be doing something else. But overall, dentistry, it's an amazing profession. So it's getting easier day by day. I would say the first 2 to 3 months after we opened up were really tough, mentally exhausting, physically exhausting, just draining. But we've gotten through it, and I enjoy it. The patients are great, and I love the profession. So it's got its challenges, but overall, it's a great profession.
Dr. Rai, I truly appreciate your time. Thank you for speaking with me today.
Oh, you're welcome. You're welcome. It's my pleasure.
Thank you for tuning in to this episode of the Stories from the Frontline podcast series. Once again, I've hosted a guest that has provided us with an immensely unique lens onto the far-reaching impacts of this pandemic. Dr. Rai is a passionate dentist that has been through so much just these past few years. It goes without saying that the information she has shared with us about the ways her office navigated a shutdown and the ways she herself learned to cope with the situation is deeply appreciated. I hope you enjoyed this episode. As always, stay safe and stay curious.